right. Good morning, everyone. We are up at the top of the hour, and since we only have a half hour together today, I want to go ahead and get going. Excuse me. Thank you for joining our talk today, um, which is vaccine hesitancy. Let's talk. I'm Candy Hansen, and this morning you will be joined by me and Dr. Jane Peterson and Alicia Goodrich. And just a reminder to mute your mic and set your speaker view set your view to speaker view, which you will find in the upper right-hand corner of your screen. Jill is going to put up a quick polling question just to get us going. Jill? And then while you all take a minute to answer, let's introduce ourselves. So Jane and Alicia, do you want to go ahead and introduce yourselves? And Jill, will you put the polling question up?
Sure, Candy, I can start. I am Jane Peterson, and I am part of Superior Health Quality Alliance. I'm actually housed in Minnesota at Stratus Health. I am the Chief Medical Quality Officer, and so work on a lot of different initiatives across Stratus Health and Superior Health, although I'm also a practicing geriatrician and work in the assisted living setting.
Hi, and my name's Alicia Goodrich. I'm an RN and also the infection preventionist at a 72-bed skilled nursing facility out of Charlevoix, Michigan called Boulder Park Terrace. Actually only took this position as infection preventionist right to enter into a pandemic. So this has been a new experience for me.
Talk about, oh my goodness, baptism by fire, huh?
Exactly.
I'm Candy Hansen, and I am a nurse by background. I also am with Superior Quality Health Alliance, and I work in a variety of settings across the healthcare settings for Stratus Health for probably 9 years now. And as it relates to this work, I have been working with nursing homes across the country in infection control, in the infection control environment. So, all right, Jill, do you want to go ahead and post the results? Okay, perfect. All right, so what are you planning on doing once the pandemic is over? Looks like the leader is hosting or attending a family reunion. And then I think the three tied ones are travel on a plane, go to an art fair or an event, and hug loved ones. I guess I should have put hug. I think I might have switched mine and put hug loved ones first, because I sure have missed that doing that with people. So, okay, let's get started. We'll take questions at the end, but please feel free to put your questions in the chat as well. So Jane and I are going to start out. And so just Jane and I have both had the opportunity to receive the COVID vaccine. Jane's had 2 doses. I have had 1. I'm actually taking my husband to get his second after this talk. So Jane, what was your thinking related to receiving the COVID vaccine?
Well, Candy, like many of the people that are listening to this, I work directly with residents in long-term care settings. So I was fortunate to be offered the vaccine in early January. And I was really happy to be in that group because it meant that I would be less likely to transmit COVID to my patients or, bring COVID home to my family, which to me was especially relevant as I had just lost my 95-year-old mother to COVID at the end of December. But to be honest, as I received the injection, it was a mixture of excitement with a little bit of nervousness.
Yeah, absolutely. And Jane, I don't know, your picture is pretty fuzzy right now. I'm not sure why that is. Oh, there we go.
Oh.
Yes, perfect. Thank you. And so for me, I'm a full-time caregiver to my husband, who has comorbidities that would not only make him not make him a candidate for a ventilator, but also even for ICU hospitalization. And so having been immersed in COVID, as many of you have been on a daily basis with so much information and so much scary information, I actually was just living in so much fear for 11 months until we were actually offered the vaccine. And for me, the anxiety I was living with while the pandemic unfolded made getting the vaccine for me just like a huge relief valve. And I know that's not everybody's story, but for me, I honestly felt like I won the lottery when we found out we were actually able to get the vaccine. So Jane, even though you were nervous, you were there and you made the decision to get the vaccine. How did you work through any hesitancy you might have been having?
I feel that I was really fortunate because I have ready access to good information, through my work at Superior Health and also through my clinical practice. Our group of clinicians had done a really good job of reviewing a lot of the clinical trial designs and the data that was collected, because we had wanted to be able to be good spokespeople to our patients and their families as they started to have questions. So it was really helpful to me, to feel confident in the science behind the vaccines, and that the benefit of the vaccine really outweighed any potential risks, which were essentially the same as any vaccine that you would get, kind of that basic things that you get when you have your body has an immune response or your immune system's gearing up, which is your sore arm, fevers, chills, body aches, those kind of things.
Yeah, and so when I say I felt like I won the lottery and it was such a relief valve, that was for the first vaccine. So, yep, yeah, I'm a little hesitant, and now having going today for our second, it's like, what is that going to be like, for the next couple of days? Because I do know that lots of people have had some of those signs and symptoms. But I, again, have to outweigh the science with the idea of just knowing that my risk will be so much reduced for sure. And both you and I have had really good channels and ready access to really reliable evidence and access to opportunities to talk through and examine that evidence. Not everyone has that. And there are so many messages out on social media that are meant to scare people and are so untrue and aren't based on any evidence or science. So, Jane, how would you suggest that people discern accurate, reliable information, for example, on social media, from messaging that isn't?
Yep. It is a big question, and I think nowadays where we have so much information coming at us, the challenge is real, and we all face it. And this is true whether we're talking about vaccines or any story that we see that kind of grabs our attention. One of my mentors told me, Jane, just because people agree with you doesn't mean you're correct. And I think about that a lot as I look at things on social media. Just because I see something and I even think I might agree with it doesn't make it correct or true. And to me, that's been a really kind of good mantra to have in the back of my head. But I also have kind of some general questions that I ask about anything that I read, whether it be on social media or an article that comes across my desk or for whatever direction it comes to try to sort out, is this good information or is this misinformation? And so the first question I'll often ask myself is, who is the author? Before I'm going to believe anything that anyone shares, I want to make sure and check out, who this came from. Should they really be considered an expert on this issue? Is this issue in line with their area of expertise? There's so many things out there where a physician is saying something, but just because you have an MD doesn't make you an expert in every area of medicine. And unfortunately, not every MD always puts out things that are completely in line with science. So it does take a little checking up on the person and where they came from and where their background is to know, is this a credible source? Is this somebody that I can trust their opinion or that I can respect their opinion? The other thing is, does it sound sensationalistic or outlandish? So if it does, you need to do your research. It should be, that's kind of a red flag. So example, I see a title that says, Elvis has been found. Local sources confirm he's a cheesemaker in rural Vermont. Well, it sounds outlandish. And there's another red flag in this one too, that local sources, when an article doesn't talk about who they spoke with and they say people close to the information or local sources, means you don't know. You don't know who they talked to. They might have talked to the taxi driver. Who knows? And then the other, is it a headline that's designed to generate clicks, which is kind of what a lot of these in social media kind of outlandish headlines are. And so you need to read beyond it to get to the real story. In this one, and this is a made up story, it's not Elvis Presley, but a Vermont cheesemaker who also is named Elvis, who dresses up in costume when he sells cheese at the local farmer's market. So, Candy, aren't you going to ask me what kind of cheese he sells?
Sure. What kind of cheese does Elvis sell?
He sells blue cheese. I just had to get that one in there. And then the next one is, are the sources of the information in the sources cited in the story? If not, it's likely not based on evidence and you shouldn't believe it or share it. So you want to make sure that that sources are listed, whether it be journal articles or things that they pulled the information from before. And it's not even a bad idea to check out some of those sources to see if they're actually real or if they're just a fake link or a fake source. And then the other one is look to see if other experts agree. If something's important, it'll be discussed on other credible forums. And you should look to see what other experts in the field are saying, as they'll be talking about it as well, especially if it's related to science. And another one of those kind of things out there in the world of science, whether it be healthcare or any area of science, the one thing that scientists love to do more than anything else is critique other scientists' work. So you will find another person weighing in, talking about the benefits and of whatever this other person said. So if you've got some good discussion like that going on, that's probably coming from a credible source because you've got other scientists really wanting to weigh in on it. And then the last one is really asking yourself, is this something I want to believe just because it supports my own biases? We all have biases, and we have to learn to be honest with ourselves and realize what we think may not always be correct or based in fact. A good example, if I choose to buy only organic foods, I see an article that states that, organic foods have more nutrients than non-organic foods. Well, even though that's not supported by science, there's a part of me that kind of wants to believe it because it supports my decision to purchase organic foods. And so that plays into the vaccine part too. If you want to be hesitant on the vaccine and you read things that promote hesitancy, you may find yourself drawn to them, even though they're misinformation. So it's really being honest with yourself and doing some of these other things to check that out, to kind of check even your own biases.
So when it comes to COVID, Jane, where should we get our information?
Well, in the situation of COVID, because it really has been a national and international issue, there is a lot of information coming out from government sources like the CDC or Centers for Disease Control, or individuals like Dr. Fauci from the NIH. Local health departments are also a good source of information, especially because it's often specific to your area. I think the challenge is in the United States, and I think other places, there's always this little level of, or not little, level of distrust of government information that gets promoted. And this isn't something new for COVID in relation to vaccines. It actually, as I was reading on this, dates back to the Vaccination Act of 1853, when that required vaccinations for infants over 4 months old. Um, so this isn't new, but something you have to realize. But still, the government sources do have a lot of highly trained, very good scientists. All those people who like to pick each other's work apart, working there. So there's a lot of really good evidence coming out. The other places are, universities, other health professionals can be sources of non-government information. And with COVID, you have to also realize, we are continuing to build our knowledge base. It's kind of like, the building the plane as we're flying it. Every day we're learning more and expanding our knowledge. So you may continue to read new things that, we just didn't know 6 months ago.
Sure. And, you and I got the vaccine because we made our decision to do it. And others are going to make the decision about when to get the vaccine and if to get the vaccine. And we want to make sure that people have good information that's clearly based on sound evidence. That being said, we know that the evidence is changing. It has continued to change as we've continued to learn more. But that's what's allowing each of us to feel confident in getting the vaccine. And we want others to feel confident in their decision as well. Maybe, like you said before, with a little bit of hesitancy, that's a good thing. But coercing and shaming just really doesn't help people make good decisions, especially about something so important in the long run.
I think, and that is probably just it's a very, very good point. We don't want to shame or blame or coerce people or make people feel bad because they are having questions. I always say, working in healthcare, we encourage questions. But besides being careful about the evidence you share, what are some of the ways that you kind of feel we should be supporting others in their decision making?
Well, I think one of the most important is to listen and to listen without judging to questions that people have and concerns that people have, to understand where they're coming from. I think that's the only way that we're really going to build trust with people. And like you said, in healthcare, we want to encourage questions, and that's how we take good care of ourselves and those who we care for.
I know that it's very true. We should be a questioning group. The reality is that with COVID, we have to do this even more because really the anti-vaccine messages they cost lives. And those lives are our parents, our aunts, our uncles, our partners, and our children, and the people we care for. And so that's the reality. So saving lives really isn't about us just pumping out more information. I think it's really about helping people find good information and helping them understand how to steer themselves away from some of the bad information.
Yeah, absolutely. And so, just in light of time here, I'm going to keep us going with Alicia. So Alicia Goodrich, who's already introduced herself, who, as she said, is an infection prevention and control officer. She's going to share her experience. She had a pretty successful vaccine campaign at her nursing home. And so she's going to share how she was helping staff deal with their concerns related to the vaccine. And Jill put one more question in the chat box while Alicia is talking, which is what additional COVID-19 topics or concerns would you like addressed at future events? So, and then Alicia's also going to put in an evaluation link in the chat. But Alicia, will you help us understand your experience?
I sure will. First and foremost, thanks so much for inviting me to talk today. I find it to be quite an honor. So for our facility, we actually had an initial acceptance of the COVID vaccine, a rate of around 82%. We have added some employees since then, so we're running right around 75%, but we've been keeping within that 75 to 80% range for accepting. So for me, to begin with, where we kind of started out, the first thing, I just started hearing a lot of talk going on in the facility. And talk that was, sometimes, in my opinion, crazy, ideas such as implanting tracking devices and the changing of our DNA. And so with that said, I was just trying to make sure that when staff was putting that out there, that they would have reliable information coming from reliable sources to have in their hands. So I remember pretty clearly one day I was in the hallway because I was trying to make myself available to them to really talk about what their reasonings were. And I was talking to a couple of younger staff and why they were choosing not to accept it. And as we were talking, another staff member had walked by and she said, "I would never take that vaccine. It changes your DNA." And so I immediately thought, do people really believe these theories? And although it may seem one way to me, to them, it isn't anything outlandish. It is a fear to them, and it's something that they believe. So with that said, I got on the computers. I started printing, from the CDC. We were being offered Pfizer first. And so I was printing clinical studies. I was highlighting the important information, highlighting the links that they could get to so they could do their own educating about this. And then I would print them and I put them in common areas such as the break rooms, such as the chart rooms, so that as they were just sitting there hanging out, preferably alone, that they could just read over that information themselves. So I just feel like everybody has a way of influencing others in some way or another. And so I thought, well, some can choose to automatically get on board and influence that negative part and say no, or we can choose to influence them in a positive manner, without pressure, without judgment, but with just offering the proven science and the studies. And then from there, it would be their choice. So when staff would approach me, I encouraged them to read the information I left, but just in general, to not indulge in all the stories on Facebook and other social media platforms. And of course, friends who would tell them things and, they didn't really have the proof to back it. So when they approached me, I encouraged them to do the research on their own, but also just, I wanted to offer them my education and say, what are your questions? What is it that you don't know or you fear? And what are those fears? And let me see if I can work through those with you. So I wanted to come across to them as informational, but not impressionable, not pressuring. And a lot of them, they really respected that I was there to answer the questions without feeling that pressure or without feeling like they were being judged. And I actually had several staff members who thanked me and said, I really appreciate that you didn't pressure me into this decision, that you respect why and all that. And so with that said, sometimes they've turned around and they have changed their minds. So originally we've had, Monday will be our fourth opportunity for them to get the vaccine. And we have had people who through the process have changed. So in the beginning it was no, and now they're saying, yeah, I do want it. So that is really good. And just knowing what their reasons were, they weren't real open at first because I think they thought maybe they would be judged. But, we have people who are trying to get pregnant and they feel there's not enough information out there. I have a staff member who, after a vaccination, had experienced Guillain-Barré. Obviously, a very traumatic time in her life, so I can understand that fear that she would have. So, I just wanted to really make sure they know, no pressure, no judgment, ask the question. If I don't have the answer, I will get you the answer or do the best that I can to get that for you.
Yeah, that's Alicia, I was going to say it really speaks to your culture because as you shared with us prior to starting this chat, you have not been with that you kind of came to the organization when COVID hit, right? So people didn't really have a lot of time to get to know you professionally, right? And here you are in the midst of COVID, and yet you have one of the highest vaccine success rates out of most of the nursing homes, anecdotally, that I've heard of. So I think that really speaks to it. And Janelle says, really appreciate your approach, Alicia.
Thank you. Thank you.
That's awesome.
And the other thing I did too was just kind of offer to them my own reasoning for accepting the vaccine, because I did get mine also. I offered them my reason, which was a lot of times, I have grandchildren that I want to protect. I have a mother who has her own health conditions and is paralyzed and, has some lung issues. And so I just wanted to make sure that I do my part to protect her. But also just in general, I feel like I have a duty to.
Alicia, there we go. Okay. You kind of froze up. Maybe it was just my screen for just a minute. So.
But just accepting the science and trusting in that and wanting to protect these people that, we have been working to take care of all this time, and just wanting to find some normalcy or a new normalcy in life. Again, 2020 was rough on everybody. And just hoping, and actually we just got good word in our area that we are going to finally be able to open up some visitation. We've watched people decline, not just physically, but emotionally, because of being kept away from their families. And I just feel that the more people we have on board with accepting the vaccine, the more chance there is, and the sooner chance there is to get people back to a normal life and to be offering visitation. So yeah. For me, I just can't stop about making ourselves available out there on the units, getting to know people, understand the reason. So if I was going to give a few pieces of advice, I would say providing them with the reliable information so they don't look to unreliable sources. Be a respected voice in their eyes without judgment and without pressure. And the fact that I would just be available, establish relationships with the staff so that they will come to you with their concerns and be more accepting of the information you have to give them.
Yeah, absolutely. Well, thank you so much, Alicia. I know we only have a couple of minutes left. I know Nancy shared she's used the technique of storytelling, and that's been successful for her. And so just in the last couple of minutes that we have left, you can unmute your mic. Does anyone have any questions or anything any technique that they would like to share that they've used successfully that's been helpful? I'll mute myself. And again, if you have something that you'd like to share, you can either put it in chat or just take yourself off mute and share with us. And while we're waiting, there is an evaluation link in the chat. If you would please take a second and copy and paste that to your browser to provide feedback. Also, if you have any other future topics, I know we've been COVID topicked to death. So, but if there are any topics that you'd like to have similar chats like this about, or that you'd like to participate in, please type that in the chat as well.
I know it seems like there's always more to learn, though. There was a question I've been going back and forth with on just that question of immune deficiency, or when people have autoimmune disorders and the vaccine, about some evidence around that to share. And I said that we can. Sorry, the dog got up. I said we can also look to see some articles, but in the conversations that my clinical practice has had on this issue, that it is safe and recommended to get the vaccine for folks with immune deficiencies or autoimmune disorders, because it's not a live virus. and still offers protection. And they were in folks with autoimmune issues were included in the trials, but we can try to get some more information if that would be helpful for folks, because I think these are some of the questions. It's, you get down in the weeds on the specific clinical conditions, and like I say, we're all learning as we're going here, and these are the kind of questions that we scratch our heads over.
Yep, absolutely. And so one last comment in the chat that said, I've read articles about using motivational interviewing, which is similar to what Alicia shared. So absolutely a very good technique to use. So it's 9:30. I want to be respectful of everyone's time. We hope that you found this chat to be helpful to you. Reach out to us if you have any other questions or anything, and we look forward to future conversations. So thank you, everyone.